ADHD, Attention Deficit Hyperactivity Disorder. We're talking about this after the words of Dr. Kathleen Taylor, who is a best-selling writer and an Oxford research scientist, who, speaking at the Edinburgh International Book Festival, has said this: there are endless examples of a tendency to medicalise things that for a previous generation would have been normal childhood or a slight problem or something. Now you get treatment. She goes on to say, autism used to be autism, Asperger's. Now it's the autistic spectrum, which means everybody can be a little bit autistic. And on ADHD, they say, if you have ADHD, you just get Ritalin. Now, we know that Ritalin is being, well, to say it's overprescribed, it's very heavily used in the United States compared to over here. But what's it like in your experience? Have you got ADHD? Do you have a child with ADHD? What's the care that you've received been like? What's the medical advice that you have been given been like? How useful has it been? We've already heard from doctors who've said we don't prescribe Ritalin or other drugs associated with it unless we get advice from a specialist first. So ADHD, is it an excuse for badly behaved children, or is it a genuine problem? You can give me a call, 0500 909 693. To text, it's 85058. To tweet, as you know, it's at BBC 5 Live. Diana Foster is with us, diagnosed with ADHD when she was 42. She's an information support officer for the West Yorkshire ADHD support group, and her son also has it. Good morning.
Morning.
And we've got Oliver James as well, clinical psychologist and the author of several books. Morning, Oliver.
Morning.
Let me just read you a few of the texts and tweets we've had already, Diana, if that's okay. ADHD is just a made-up word to excuse naughty children who've been badly brought up, says one. Another, an excuse, just like ME and yuppie flu. Here's another one. It's not an excuse for naughty children, it's a get-out for parents who are weak and choose not to take their responsibility seriously, says Reevy. What do you say?
Not much to say, is there? I think if they actually lived with a child who's got ADHD, they'd probably have a different view. I can't blame them, because before I had my son, I used to think, oh, it's a discipline problem. But I have two children and they're totally, opposite. So it's nothing to do with my parenting. It is a genuine condition, and it can be extremely complex. So if you imagine like an iceberg, you only see the top of it, and most of it is hidden underneath. And with ADHD, it's exactly the same. The behaviour is often because of the problems that they're experiencing with organisation, concentration, impulsivity. So they'll do things without thinking about the consequences.
Right, give us an idea then of what it's like and your son's behaviour.
Well, my son, I knew very early on that there was something not quite right. I didn't know what it was, but from a very early age, as soon as he could toddle, he used to run off, for instance. No fear, no nothing. And everyone used to say, oh, just let him run, because once he can't see mum, he'll stop. But with my son, it wasn't. He wouldn't stop. He'd just carry on. I suppose in his little head, he knew where he was going. So my house ended up like Fort Knox, with my windows tied up, extra bolts and chains on my door, because he used to just escape. So it was just impossible to leave him, even just for 2 minutes. I would have to take him to the toilet with me, for instance, because if I left him downstairs, he'd be gone. So we're talking about extreme behaviour here. It's not, it's not something made up. It's nothing to do with discipline, because, there is consequences. ADHD is an excuse. It explains why children do things. So, but a lot of the time the parents are getting blamed for it.
And you believe you have it?
I don't believe I know I have it, yes. I spent most of my life wondering, why I couldn't do stuff the way other people would do it, because that's what you do, you compare yourself to others.
What kind of things?
For instance, I'd start dusting and then I'd see a cobweb and it sounds really silly, but I'd go and get the cobweb and then I forgot that I was dusting, so I could spend all day going around the house doing stuff and never getting finished. Putting something on the cooker, forgetting about it. And I'm not talking occasionally, this is all the time. So, when people say, well, we all forget things occasionally, we all do this and that occasionally. This is not occasionally. It's all the time. So it's impacting on your life all the time.
Oliver James, is this a medical condition?
Well, I think that the latest evidence shows absolutely clearly that there is no genetically caused brain disorder involved here. What is the case? I very much sympathise with, is it Diana that's speaking?
It is, yes.
Yes. I mean, of course, I understand what you're saying, that your child, for example, may have been born, as a result of things that happened during the pregnancy. It would appear that things that happened during the pregnancy are much more significant than was ever thought. And, for example, if a mother was stressed during the last 3 months, the last trimester of pregnancy, then her child is much more likely to have ADHD, twice as likely, aged 7 to 9, and the child can be born wired. So, let's not say that that there aren't any biological factors involved. What happens is that the mother, if she's stressed, has high levels of the fight-flight hormone, cortisol, which are passed through the placenta into the baby, and the baby is then born with dysregulated, abnormal cortisol levels, which, unless the mother, does an extraordinary job, it's quite difficult to correct, although it is possible to correct. And that's the thing that I would want to just stress, is that really giving amphetamines, we wouldn't give cocaine or heroin to our children.
I'm sorry, but I'm going to have to interrupt you here.
Yes, go ahead.
Because ADHD rarely comes on its own. I mean, you're saying it's not genetic, but I can trace this sort of behaviour back through my whole family. I have several.
I'm sure you can. Yeah.
I have several relatives who've also got the condition. So
Can I now interrupt you?
Yeah.
The fact that something runs in the family does not tell us whether it's either genetic or environmental. It could equally be that the way your parents cared for you and the way your parents cared for their parents, etc., running back, there are.
But I'm talking about cousins.
Yes, and it can be whole family cultures. It really is a fact that is the case, that there are whole families, for example, and I'm not suggesting this has anything to do with your family, but, for example, sexual abuse very much runs in families, and it's past abusers. People who abuse were themselves very frequently abused. So there are patterns of behaviour which can be passed down families. And what I'm saying about the genes is that we really do know now from the Human Genome Project that when they look at differences between siblings, they can find some differences in the genes sometimes, but they explain virtually none of why one person is different from another. This is what the Human Genome Project is proving, almost beyond a doubt now.
It's very interesting. Tell us.
Very little role in causing almost any psychological traits, including intelligence and personality, as well as pathologies like ADHD.
Oh, it's really interesting subject area. Tell us, you say you wouldn't give a child amphetamine. I mean, what is Ritalin exactly? And do you believe it can be effective in some circumstances ever?
I think that there are definitely children who are given Ritalin who stop being as hyperactive. But unfortunately, there are quite a lot. There are always side effects of any drug you take, and it is essentially the same chemical ingredients as amphetamine, and we really wouldn't. Amphetamine is a banned drug for very good reasons. It's really very bad for you to take amphetamine. The reason someone like David Bowie, for example, had a heart attack in his early 60s was that he took far too much speed when he was young.
Yeah, but the brain of an ADHD child or an ADHD adult is wired up differently, and speed does not make us more hyperactive. It actually calms us down. So a lot of.
Are you on Ritalin?
I am, yes.
And is your son?
Yes.
And is that, how long have you been taking that for?
I've been on it since I was diagnosed.
And do you think that will be a lifelong treatment for you?
Well, it certainly helps me to concentrate. It helps me to stay on task. It helps me to focus. For instance, my achievement, I've always been predicted A's and B's. because that's what my tutors used to say that I was capable of achieving. But when it came to the written work of exams and things, I was never able to concentrate, and the reading comprehension wasn't there. So if a question was open for interpretation, for instance, I would need more details to understand what the answer would be.
So it seems to work for Diana, Oliver James.
And I can completely understand why, Diana, I totally understand why you would take a drug that helped you to be able to concentrate. The only thing is that there are alternatives in terms of you, and even more importantly, and this is something I would be really interested to engage with you about, is if you would like to try using, there's a very simple technique that I developed called love bombing, which consists of, for 3 to 12-year-old children, consists of giving them a very intense, condensed experience of feeling loved. And I'm not saying you haven't been loving. You sound like you've been a very devoted mother, having to create Fort Knox, given how difficult your child was being. But you just try this. Give your child the experience of feeling completely loved and completely in control. Get rid of all the other members of the family and be one-to-one. Build up to it. You have to build up to it and give it a name and call it mummy time or something. The child...
Yeah, I'm sorry, but my son in the meantime is 23.
Well, okay, then in that case it wouldn't apply. But for parents listening who've got a 3 to 12-year-old who has got ADHD, my book, Love Bombing, describes many cases of children who had ADHD, and literally after one weekend, it reset their electrochemical thermostat. So I'm totally there.
Right. So you don't believe that the latest studies, for instance, of one in every 3 children who have autism also have ADHD. So that's because they're not loved.
Well, in the case of autism and Asperger's, I think, of course, there is comorbidity. Of course, there is. But the proportion of the population who have autism is only 1%. So, whereas the proportion who are being diagnosed with ADHD is vastly greater than that. But of course, there are overlaps between these things because the kinds of difficulties. The kinds of. I'm afraid it's nothing to do with discipline at all. It's to do with whether the mother has been able to tune into the baby in the earliest months, and then subsequently, when it's a toddler, being able to be led by the child.
And okay, so you say the mother. Can it be mother or father? Just to be clear, Oliver James.
Absolutely, the father, ideally, of course. But as we all know, in reality, let's not be politically correct and unreal about this. We know perfectly well that the vast majority of small children are cared for primarily by the mother, for whatever reason. I personally wish it would be much more men doing it, but it is the mother, let's face it, in most cases. And what the key thing here is that babies need to be loved. It's very, very simple. And then subsequently, toddlers need to be understood. When they're 2, but when they've only got a few words, their capacity to grasp the difference between right and wrong is non-existent, and it's a complete waste of time shouting at them or trying to explain things to them. And far more than using naughty steps, what they need is understanding and sympathy and empathy. And if you give that to them, they then gradually learn to self-regulate.
Okay. Oliver.
And really, that's what's the problem. It's this nonsense about discipline or castigating parents for doing a bad job. It's not that. It's that parents have a hell of a difficult job. And they're very, particularly because so many have now to work, often the substitute care isn't very good. And as a result, the children are very anxious and insecure, and that certainly does affect their brains, Diana. You're absolutely right.
Oliver, I think we have to let you go.
Corrected by love bombing.
I think we have to let you, I only interrupt because I know that you have other commitments, but thank you very much. I think you've opened up, half a dozen potential Your Call subjects there for us. But Diana Foster with us. She's got ADHD. She was diagnosed when she was 42. Her son also has ADHD. This is what we're talking about this morning, and I think now we can speak to Ruth, whose son William has ADHD. Morning, Ruth.
Morning.
Paul in Manchester as well. Morning, Paul.
Morning.
Nice to have you talk to us. And Simon in New Barnet. Good morning to you, Simon.
Good morning.
Ruth, let's start with you. Tell us about William.
Well, William's 9 and he's been taking Medicanet, which is a slow-release form of Ritalin since the age of 7. But for a very able child, we soon realised when he started school that things weren't right, because he couldn't put anything down on paper. And as a teacher, that was an alarm bell for me to have him tested. And although he had some behavioural challenges, it wasn't the diagnosis we were expecting, because I have a perfectly normal 11-year-old daughter. So it did come as a bit of a surprise.
Yeah. Ruth, I think William wants to talk to us, and you're happy for him to.
He's right here.
Yeah, okay. Well, have a word with him then, if you pass the phone over.
Hello.
Hi, William. How are you doing?
Fine, thank you.
Thanks very much for talking to us about this. Tell us, are you aware that sometimes you find dealing with what happens in school and so on more tricky than perhaps your friends who are the same age?
Yes.
And how does that feel? Give us an idea of what that's like for you.
Well, ever since I've taken my medication, I found it a lot easier to control myself. But before that, it was just kind of, get the grumble kind of thing.
Get the grumble?
Yeah.
What's that?
Well, it's just kind of like before I took my medication, I couldn't really control my anger, so I just took it out on other people. But now I don't do that, really.
And did that make it harder to form friendships?
Yes.
And presumably to study as well. So what difference has it made now?
It's made a big difference for me at school. It's made school a lot easier for me.
Do you know, William, we've got Paul as well. And Paul, you're 13. And again, I should say that your parents are happy for you to talk to us. Paul, nice, good of you to get in touch.
Okay.
Paul?
Yeah?
When were you aware that you might have an issue? I don't want to say that you've got a problem, but that there was something there that you felt you needed help with.
Probably around the ages of 8, and then at the age of 9 years old, then my parents took me to a psychologist. They got this program from America, the Total Transformation Program, and putting those two together, it was very helpful, and I just managed to be able to control my anger and at school concentrate a bit more and not be so impulsive.
Tell us a bit about the program. What does it involve?
The program involves something for the child and for the parent. So the child part of it is like how to control yourself, take 10 deep breaths, and so on. And for the program, it's just managing and just audio lessons and just a lot of things, how to manage your child.
And are you on medication, Paul?
I was for quite a long period, and now during like the holiday period and just I'm learning to manage it a lot more.
Yeah. And what was it like before then? Give us an idea.
I was an extremely impulsive child. At home, I used to just have tempers. I used to absolutely just blow the place up. My brothers and sisters were scared of me. My parents didn't know what to do with me. I often got in fights with them. And then at school, it wasn't as bad. I didn't have fights or anything. Boys were quite friendly with me, and I just couldn't concentrate, and it was very difficult for me. But maybe that's why boys were friendly with me, because I'm the clown of the class.
Mm. And you had some very dark moments, didn't you?
Yeah. I even, one point, I got so frustrated, I just tried committing suicide.
Right. So this programme has really, really helped you. And what would you say to William? Because he can hear you. Do you want to talk to him and tell him how you've managed things and how your life has improved?
I don't know what to say.
William, is there anything you want to ask Paul?
Well, as you've got older, do you find it a lot easier to control your anger, even when you're not on tablets?
Yeah, it gets much easier. And another way to help is by keeping yourself busy and just not thinking about it too much.
I don't think about it much either.
Me too.
And boys, both of you, when you hear people say ADHD is used as an excuse for children's bad behaviour or bad parenting, how does that make you feel?
I feel very insulted. I mean, how can they judge what it's like? And as well, it was my parents who took the choice to go for a diagnosis or not.
What do you say, William?
Well, I think more of it as something which you're just born with. You can't really stop it from, being with you. I don't really think of it as an excuse for badly behaved children. I actually think it's a condition which doesn't really make you any different from other people, really.
Listen, thanks so much to both of you. And good luck with everything. Good luck with the programme you're on. William, thanks very much.
Thank you. Bye.
Cheers. Bye-bye.
Thank you. Bye.
That's Paul, who's 13, and William, who's 9, both been diagnosed with ADHD. Let's have a quick word with Simon in New Barnet. Hi, Simon. Thanks for hanging on.
No problem.
Your son was diagnosed with ADHD. Tell us about him.
Yeah, my son was diagnosed with ADHD when he was about 23 after effectively losing his entire adolescence to the condition. I do take issue with someone like Oliver James coming on and undermining an understanding of the condition, because it should be taken in context that he also criticises the genetic origin of things like schizophrenia and depression. It's not just ADHD that he contends with. And, he's a psychological generalist, and I do speak as someone who has a psychology degree myself. I think listening to those two children tells you everything you need to know about what it's like from the people who actually experience it. And it's very easy to come in from the outside and have a sort of vaguely informed opinion about something you really don't know a great deal about. But when you actually have to live with it, it's a completely different kettle of fish. I mean, I saw a very loving, happy child of mine change over time and then become somebody we really didn't recognize. His behavior changed completely. And eventually, he dropped out of school. He didn't get a single qualification. He became involved in drugs. And eventually, he became so unlivable with that we had to put him into care. And he still has the condition. It took us quite a long time to get him a diagnosis, not from somebody like Oliver James, who's got lots of books to promote, but from a psychiatrist who specializes in this field. And, he's living with the condition now. It's ongoing.
That's for a parent to take a decision like that when to put a child into care.
Absolutely.
Is an extreme position
of course,
to be forced into.
And you wouldn't take that decision if you thought your child was just being, in inverted commas, naughty or a little bit out there. This is a child who's, whatever the source of it and whatever the origin of it, his brain chemistry is such that he's out of control. His behavior is impulsive. He can't plan for anything. He can't understand the consequences of anything he's doing to himself or to other people.
And how is he being cared for and treated now?
Well, part of the problem with the condition is that people who have it aren't necessarily the best people to manage it, because it requires taking medication. And having ADHD means you can't really plan that well. So taking medication on a daily basis is quite difficult. So, he has to be reminded quite a lot to take it. Sometimes he forgets to take it and forgets to go for his referrals. So it's an ongoing issue.
Do you think you'll get your son back? And I don't mean just physically back, but...
We have our son back in a form. He's worked very hard with himself and his own willpower to not be a slave to the condition, and he now works. He lives by himself. He's got lots of friends, and he has rebuilt his life. But when I sit here and listen to someone like Oliver James sort of gently pour scorn on the idea that this condition exists, and I look back over the debris of my son's adolescent life, I just think, well, live with it for 5-10 years, and then tell people who do live with it that it's dubious or its origin is sort of a bit hazy, and it's really down to the mother being stressed during pregnancy. I mean, he doesn't really know, and arguably people don't necessarily know, but in the same way they don't necessarily know the origin of schizophrenia or depression, but no one's arguing that it doesn't exist. And no one's arguing that those things possibly aren't overdiagnosed. I don't have a problem with that issue, but I have a problem when that contention affects people's understanding of the actual condition as it occurs in real people who have to live with it on a daily basis.
Simon, thank you very much. That's Simon in New Barnet talking about his son. Just a quick thought from you, Diana, on what you've heard.
Like I said, I help run a support group, and we get calls all the time of people who have had these experiences, and all I can say is trust your instinct, because my son at 8 was suicidal, and that was because, he was getting permanent negativity, he was getting in trouble at school. I was listening to the professionals, because that's what you do, you assume the professionals know best. And so in the end, he was getting negativity at school, negativity at home, and he ended up with very low self-esteem, and ended up with suicidal tendencies at age 8, and that is when we went to the doctor, and obviously we were referred to a specialist, and it has got to be an ADHD specialist who diagnoses it.
Okay, Diana, thank you very much, and we're going to continue this discussion, of course. Good morning. This morning we're talking about ADHD, attention deficit hyperactivity disorder. Is it overdiagnosed? Is it a genuine condition? Are too many drugs being used to treat children unnecessarily? What do you think? 0500 909 693. We've heard some very powerful examples this morning of children and adults who've contacted us who have ADHD or been affected by those who have ADHD. But what do you think? Give me a call. And you can tweet as well at BBC5 Live. Mark in Grimsby, for example, says this: if you cannot concentrate, you have ADHD. My God, he says, it has to be hard to get a diagnosis because there is no such condition. It's an excuse for feeble-minded parents. Well, what do you think? Do you agree? Let's talk to Simon in Scotland. Hi, Simon.
Hi, good morning.
Tell me about your boy.
My lad, who we're extremely proud of, was diagnosed as a young boy with ADHD, and of course he had the usual problems in school, not concentrating, being disruptive, and the school that he was in, he was given half a Ritalin in the morning, which then just made him fall asleep, and half in the afternoon, and again it made him fall asleep. Me and my wife, we were second marriage just at that time. And we then took him to Germany, where I was with the forces. And when we got there, we decided actually that we would take him off Ritalin. And it was the best thing that we ever did for him.
What change did you see when you took him off the drugs?
Well, it was not a case of what did we see when we took him off. It was what did we decide to do when we took him off. Because what we felt was he needed a focus in life, because what we've found is he is incredibly talented with his hands and in anything physical that he does. It's the mental things that he struggles with, concentration, with maybe studying, maybe letter writing, or maybe even adding up. But what he does with his hands is phenomenal. And I was an instructor in the army at riding. And I taught him to ride, and he is now gone on to be a fantastic jockey, and he wins regularly up here in the south of Scotland.
Oh, really?
And we're incredibly proud of him.
So therapy through a kind of different kind of practical application of his skills, I guess.
Yeah, I mean, what we had to do is right at the beginning was change our perspective of what, because we have 5 children between us, and 4 of them don't have ADHD, and he did. So we had to actually change our way of looking at parenting to him, because we found, for example, when he did something naughty or he was disruptive, he would smile. And, of course, most people would think that that's him laughing at something he's done wrong. But that was his embarrassment. And we had to learn to adapt to that and find, as parents, how did we look at each of the children individually and then focus our attention on them and make them better. And it was great that the other children then realised that. And as a family, we were able then to move on and look at each of them individually.
Responded to. OK, Simon, stay with us. Dave in West London as well. Dave, you had ADHD diagnosed as an adult, didn't you?
Yes, that's right. Yes, I was diagnosed with ADHD something like 4 or 5 years ago now.
And you've also looked at different methods of effectively treating yourself.
That's right. I initially tried medication. Ritalin didn't give any benefits. Dexedrine brought a little bit of benefit, but nothing material. And then I came across yoga and meditation, and I found a discipline called Kundalini Yoga, which is quite dynamic in that it has a lot of specific meditations that can help with your concentration. And I've been practicing this for over 2 years, and the benefits have been profound. It's come to a point where doctors have taken me through computerized tests, which look at my working memory capability, my mental speed, my mental agility, and my performance now in those tests are even better than what I had when I was on medication. So I've been able to improve my powers of concentration through practicing yoga. And now I don't take any medication because I can manage very well off it.
So medication, not the answer for everyone, certainly, and that's something that's been talked about this morning. Is it overdiagnosed, and is Ritalin overprescribed, and other drugs like it? Stay with us, Dave and Simon. Here's Martin. Good morning, Martin.
Morning, all right.
Yeah, what do you make of the discussion we've been having?
Yeah, I've called in because I've been talking about this recently with family members and friends, etc. I'm now 21 years old, and right the way through school, as far as I can remember, I've always been a hyperactive child. I've always tried to be centre of attention. You know, I've always been part of that kind of crew. Now, listening to a lot of people and what people are saying about ADHD, I just listen to the symptoms and I just start ticking the boxes. I just go, yeah, I do that, I do this, I do that. And it gets easier as you get older. I mean, I still experience tunnel vision, which is a strange thing. But if I'm quiet for any less than half an hour, I get quite spaced out, I get quite zoned out, and it's quite a strange feeling. But I think the worst thing that anybody could have done is label it. It's human nature. As soon as somebody labels it, a lot of people go, well, yeah, I've got that. Yeah, I've got that. You know, let's get medicated for it. And I just think a lot of the time it is an excuse. People do play on it. I've never gone to see anybody about it. I did at one point at school have anger management issues, and saw I had to go for a class, if you see what I mean, a couple of classes just for anger management. But by that, I keep myself active. I live an active lifestyle. It keeps my mind off things, and you just deal with it. You just get on. But give it 20 years ago, this wouldn't have really come up.
So do you think that you have a condition like ADHD, or do you think this is just different personalities?
No, well, I do believe that I have a form of ADHD. I do, but I just think it's character, and I've always been told it's character. You know, I've always been. Rachel. I don't mean to be big-headed about it, but I've always kind of been the life of the party. I've always been the person in the centre of attention, and I'm louder at home than what I am at work.
Yeah, is that Dave?
Yes, hello.
Yes, hi.
Yeah, I think, we need to recognise in this discussion, and I may be repeating things being said earlier, but ADHD is a spectrum disorder. So, someone could be far along the spectrum, but may not have it to such an extent where it's clinically diagnosed. And then someone further along the spectrum, someone who is very addictive in their nature, is taking a lot of drugs and doing all sorts of things, will have their life immensely impacted to the point where they need a clinical diagnosis. So we need to, separate the two and understand that it is a spectrum disorder.
I completely understand that.
And Simon, just a thought from you as a dad with a boy who's had this. Was it helpful for him? Because we heard from a 9-year-old and a 13-year-old who clearly kind of knew and acknowledged their condition and were accepting of it. Was it helpful to him as a child growing up to have a diagnosis?
Yeah, he did. And actually listen to the other young lad there who's 21 who said that he thinks he may have it. The symptoms that he's describing as the centre attention, hyperactive, if he doesn't maybe do something for half an hour, he then maybe goes a bit tunnel vision. My lad is still like that at times, but that is us as his parents and others around him recognising those things and then giving him other things to think about. And of course, as he's getting older, he is through not necessarily the treatment that we're giving him, but through the responses that we're giving him, he is actually becoming less disruptive or less centre of attention, but he still has small lapses, and this is where us as his family around him are able now to guide him, rather than when he was younger he had the controlled drugs through the Ritalin. So no, anyone who's going through this, be positive, because there are people out there who have gone through this with you and talk about it and share these experiences, and hopefully you can improve too.
Thank you very much to all of you. Martin, Simon, Dave, many thanks. 0500 909 693. It's interesting that as the discussion goes on, more and more people saying, well, yes, this is a real and genuine experience in my life, whether it's me going through it or a family member going through it. But why are people still saying this is not a genuine medical condition, that it's being overdiagnosed, that the medication is being overprescribed? Is that what's happening in your experience? Interesting text here. Yes, I'm a high school teacher. I work with many children diagnosed with ADHD. No doubt the condition exists in those such as the two young boys you spoke to this morning. What I have seen, however, are children who are basically naughty yet use ADHD as an excuse. And so I have seen firsthand the overdiagnosis of this condition. This also does a disservice to those who genuinely suffer and require help, yet at times are ridiculed. 85058 to send a text, and it's at BBC 5 Live as well to tweet. It's 9:50 exactly, and Michelle's got all the travel news.
Well, let's start with the M25. Anti-clockwise is taking about half an hour to get from junction 18 at Chorleywood to 16 for the M40. Clockwise, long delays between junction 9 at Leatherhead to junction 15 for the M4. Not helped by queues from the A312 Parkway back onto the M4 past Heathrow. Elsewhere, the northbound M1 between junction 29A at Markham Lane and junction 31 at Sheffield, just about back to normal now. The M6 in both directions still has one lane closed for barrier repair work. That's between junction 3, the A444 at Coventry, and 3A where it meets the M6 toll, causing northbound delays back to junction 2 for the M69. In Northamptonshire, the A14 westbound remains closed between 7 at Kettering and 3 at Rothwell, causing long delays. It won't be open until this afternoon. And the eastbound side between junctions 3 and 4 also has one lane closed. And Greenwich, the A102 Blackwall Tunnel approach northbound is closed at the Woolwich Road flyover because of an accident. That's causing queues back to the Sun in the Sands, and not helped by the fact that the A206 Trafalgar Road in both ways in Maze Hill is also closed because of a separate accident. Michelle Dignan, 5 Live Travel.
This summer, a city will come alive with performers at the largest cultural festival in the world. And next week, there's even more drama, music, fun and laughter when I take my 5 Live show to the Edinburgh Festival. Each day, I'll speak to some of the festival's biggest acts. We'll discuss the highs and lows of performing on the circuit, find out who's creating festival buzz, and let you experience the colour and the magic wherever you are.
Richard Bacon.
On 5 Live Monday at 2.
The 2013 Edinburgh Festival on radio, on TV and online throughout August on the BBC.
Be part of it.
This is 5 Live Breakfast. Your call.
Someone's just tweeted us here, my son has ADHD, someone have him for the day and then tell me he's just naughty. There is a big difference. Let's talk to Steve Tomlin, who's a consultant pharmacist from the Royal Pharmaceutical Society and an expert in paediatric medicine. Thanks for holding on, Steve.
That's quite all right.
One of the reasons that we brought this up is because there is believed to be by some an over-prescribing of certain medications. We've mentioned Ritalin a lot, but that's one amongst many, particularly for young people in this area. Is that the case in your experience?
No, I don't think we've got an over-prescribing in terms of using the drug for the right diagnosis. What there potentially is a slight variability in people that actually diagnosing and therefore coming up with a diagnosis which might not be 100% sound initially. But I think from what everybody's been saying, and which I agree with, it is a spectrum disorder. And some patients will benefit and some won't. But the use of drugs should never be first line in a condition like this. And behavioural psychology and working with the children initially is what must happen. Once the drugs do start, they'll work for some and they won't work for others. And therefore I'm not surprised that some of the listeners are saying that they actually were worse when they were using the medicines or they didn't get on with them. That's not surprising. Drugs work in some patients and they don't work in others.
Certainly not the magic bullet for all. But yet we heard, for example, from someone texting earlier to say when their son was diagnosed, it was almost like, right, here's the Ritalin. No other form of therapy offered, no other options discussed.
Well, I'm surprised at that. There is national guidance from the National Institute of Clinical Excellence, which basically says, the drugs are right to use if the diagnosis is there, but they should be used in combination with working with the child, or in these days, also with the adults.
I tell you what, Steve, I wonder if I can bring in Helen in Bristol at this point. Morning, Helen. Helen, are you there?
Yes, I am.
Nice to talk to you, Helen. Let me introduce you to Steve Tomlin from the Royal Pharmaceutical Society. Your son has just been diagnosed, so tell us about your experience with your doctor.
Yeah, we've got a 10-year-old, and he's got ADHD, and he's also got autism. When he was diagnosed with ADHD, the first thing they did was put him on the drug. Now, we think that that's been done because he was having terrible trouble at school. And the drug is helping him at school, but it doesn't help us at home, because by the time he gets home, it's worn off, and we get the backlash of that. And we haven't been offered any other option. And I don't like him on the drug, I must admit, because he's a completely different child. He's not himself.
Okay, I'd say it's a spectrum disorder, and when Ritalin or methylphenidate originally came out, the length of action was literally to cover the school period, because what the medicine is actually trying to do is almost integrate the child back into society in terms of at least being able to have an education, which is often where they're most disruptive, and things like that. And therefore, that's exactly what the drug was designed to do. Now, there are different formulations and different ways of looking at it now, and there is no doubt about it that some children also need help later on in the day when they're back at home. But some of the listeners have been saying about they just managed to get through, by using different methods, and that has to be part of it. And therefore, it's not that these patients have got some debilitating disease. These medicines are there to try and help them back into normal society, and that, in terms of children, is often part of schooling, and that's why the effect is like that.
Yeah, Helen, here we'll have another viewpoint from Malcolm in Blackburn. Morning, Malcolm.
Good morning.
You deal with children with ADHD, don't you? What advice would you be giving Helen now?
Well, I'm afraid I haven't listened to the show since I got out of the car, so I'm not sure what's been said in the last 35, 40 minutes.
Well, let me just tell you briefly, Helen's son is 10, Helen, is he?
He's 10, yeah.
And he's got ADHD and autism, and she doesn't really want him to be on medication, certainly not full-time. What are the options?
Well, I just wanted to say that I found it unhelpful that the only professional in the room was a child psychologist who had a particular view, which in a sense was very much against the idea of diagnosing and treatment. I'm a generic child psychiatrist in Blackburn. I'm not a particular specialist in ADHD, but I see that condition along with all the other children we see. And I think that the child's mental health community is very happy to consider that for some children, the deficit in paying attention, in concentrating and being impulsive and sometimes being hyperactivity often do clump together, and we haven't, as it were, picked out a particular gene for it any more than we have the cancer or anything else, but we're aware it's a biological condition that, like anything else, is affected by the environment in the way that it presents. So it's very hard for me to give advice to an individual who I've not met, but it seems to me that if the diagnoses are solid, we're talking about ADHD. Autism is a completely separate thing, which I am a specialist in, but we don't tend to use medication to treat autism as such. But for ADHD, the clinical evidence is that for younger children, or certainly primary school age children, and maybe secondary school age children, the first line, safest and most effective treatment is medication. But there should also be a lot of psychosocial support for parents in helping deal with these children. But I don't think anyone should be forced to take medication. I think Helen presumably has access to a clinic, which is where the diagnoses have come from, and it's up to her as a mother to discuss the options with the people running the clinic and to see what might be most effective.
Malcolm, thank you very much. That's Malcolm in Blackburn. Thanks to Steve as well. Helen, how are your school summer holidays going? How are you managing?
Well, my husband's stay at home. Unfortunately, I have to work, so he's the one that has to deal with it. And the other thing I wanted just to point out is trying to get a child that has ADHD to take a tablet every day. You end up having a battle, and that's the other point. I think you can't make a child take the tablet, and that can be very. That can itself end up in a big argument, and they don't understand why they have to take those tablets because they don't think there's anything wrong with them.
OK, Helen, good luck with it all. I do hope you find an answer. Helen in Bristol, bbc.co.uk/action line if you want to find out more, get more support. Thank you very much.
First for breaking news and the best live sport.